Well, these brutally cold temperatures can turn dangerous very quickly. It doesn't take long for hypothermia or frostbite to set in. We've asked Dr. Gina Hunke from Deaconess Gateway Hospital to join us to talk about how to navigate this cold spell safely. Dr. Hunke, thank you so much for joining us. We appreciate you taking the time today. I wonder, are you seeing an increase in weather-related visits to the ER? What are you seeing?
Well, today we really haven't. Thankfully, I think everyone's being really smart about the extra cold weather, and for the most part, they're staying indoors. We've basically only seen severe emergencies today.
So when you say folks are being smart, and of course staying indoors is one way, but if you have to get out in this kind of a weather, what is the most important thing that folks do?
Most importantly, it's best to be prepared. If you're going to go out in this cold weather, and please dress appropriately, dress in layers, wear gloves, cover up your fingers and your nose and your toes in extra warm clothing. And if you're going on a car trip, please be sure that your car is full of gas, that you have a shovel and a blanket, some food and some water, and that your cell phone is appropriately charged just in case you have an emergency.
Right, those are excellent points. Now, you know, I know that in weather like this, you hear about frostbite or hypothermia. How long does it take for something like that to set in?
It can be very surprisingly quick, especially at these severe temperatures, and especially when there's such severe wind chill. And sort of depends on other medical conditions that you might have or medications that you're taking. So don't be fooled just because someone who's very healthy and young can stay out for 10 or 15 minutes, that same 10 or 15 minutes might be very severe for someone who has medical conditions or who's young or older.
So what kind of signs should folks look out for? What are the symptoms of frostbite or hypothermia?
Well, when people first get hypothermia, they feel cold and start to chill, and that's when it's really time to go inside if possible. We really become concerned when patients no longer feel that cold and they're too confused to be able to get in from the extreme weather. That is when it's very, very concerning. So if you're with someone who becomes confused and you're out in the cold, that is the time to seek medical attention.
So go to the doctor right away. Don't delay at that point.
Exactly.
Okay.
Yes.
Now, I've also heard that extreme cold can pose a problem for people with heart conditions. It constricts the blood vessels. Is that correct? What do they need to look out for?
That's very true. And we frequently see persons who have heart conditions who are out in the cold or maybe even trying to remove snow from their driveway, and they have a heart attack while doing that. So if you start to have chest pain out in the cold, that's the time to get inside immediately, stop the physical activity, and seek attention.
Yeah, just maybe get some help in doing things like that. Don't even try it in some situations if you have a heart condition already. Now, what about children, Dr. Hunke? Should they be outside in this kind of weather?
Well, for the most part, we say that children should be outdoors for a very limited time. You know, just actually going outside to maybe go to the car or run an errand, but not really playing outside for long periods of time. It depends on the age of the child as well. So younger children are more susceptible to cold exposure, and they should be limited their time outdoors much more than older children.
Right. Everyone just needs to use common sense, stay inside if they can, and if they have to go outside, limit that time, stay warm, and if you have any pre-existing conditions, be extra careful and maybe have some folks help you out there.
Yes, indeed.
All right, Dr. Gina Hunke with Deaconess Gateway Hospital, thank you so much for taking the time today to kind of remind us of some of these things that will help keep us safe in this cold weather. We appreciate your time.
Thank you. Be safe, everyone.